morning from the 17 studios. I'm Alex Fisher. We are breaking into our regularly scheduled programming to bring you the latest on the coronavirus crisis here in Kern County. Just moments ago, we've learned that 194 people have tested positive for coronavirus. We learned those new cases just moments ago. We've also learned that another person in Kern has died to this virus. That means that 229 people have died from coronavirus since the beginning of this pandemic back in March, and 27,378 people have tested positive for this virus since the beginning of all of this. Here's some good news, though. We've learned that a couple more hundred people have recovered from the virus. That means that we are looking at about 10,000 people that have either been officially recovered or have presumed to have recovered. So that is definitely some good news. It's about a third of our total case count here in Kern County. So again, a couple more hundred people have recovered from this virus. Now, this morning is the weekly briefing that our county officials do and hold to give us the latest on the coronavirus pandemic. As you know, since the beginning of all of this, so much changes every single day, it seems like. And so once a week, they take time to talk to our community and give us the latest information that we need to know. One of the topics that they've really been talking about over the last several weeks includes hospitals and the overwhelming the hospitals being overwhelmed by this influx of new cases and patients coming into these hospitals with coronavirus. And again, we've seen our hospitalizations, for the most part, be about between 250, or around 250. Today, we have the official number at 241. So that's slightly down from yesterday. That's, of course, good news to see less people in the hospital for coronavirus, but still relatively high for our community. And that is a number that continues to be high. And the other issue that we are, of course, are dealing with are the amount of people dying from this virus. That number has continued to go up over the last several weeks. We really started to see an influx of cases back in late June to early July. And since then, we have, of course, seen our hospitalization rate and death rate increase. Let's take you live to the county administrative building and let's listen in to the latest from county officials on the coronavirus crisis here in the county.
Epidemiologist. Quickly before I turn it over to Matt, I'm going to give you an update on testing from the county funded sites. We've tested 47,375 people at the federal surge site alone. There have been 6,963 tests completed. I want to remind everybody that on Friday, that will be the last day of testing at the federal site there at the fairgrounds. So if you're looking for an appointment, that is a good place to go before the end of the day on Friday. Additionally, all of our sites are reporting low wait times, same day ability. So if you have not been tested and were concerned previously that there was a long wait time, know that that number has come down quite a bit. So we would encourage you to get tested if you feel like you need to. That information on all of our test sites is available at kerncounty.com. Again, there's a big button right on the front page that you can click on and it will give you all of the information. Additionally, before I hand it over to Matt, I want to give you an update on some information that our CAO would usually provide. So on Tuesday, the Board of Supervisors approved two items. First was a PPE distribution of masks and potentially other items through a partnership with the Community Action Partnership of Kern. They'll be using their food bank distributions, their WIC stores, their youth centers and senior centers, and some other programs to distribute PPE to community members who may not be able to secure them otherwise. So we're very excited for the partnership with CAPK and appreciative of their support. Second, the board also approved $1 million in grant funds for nonprofits here in Kern County. That's part of the Kern Recovers loan program that we extended to businesses, where we loaned out $30 million. So we're excited about that program as well. We believe that the applications for our nonprofits will be available around the 1st of September. It's also available on the Kern Recovers page for kerncounty.com. So please check back there closer to September 1st. Finally, on the loan forgiveness program for our businesses, we are now accepting loan forgiveness applications, and that information is also on the Kern Recovers site. So if you received a loan from the county related to the Kern Recovers program, you should have received a letter recently indicating that you can now submit your forgiveness application. That application is available online, and you will submit it to the lender that you received your funding through. And that is all of the updates that I have, so I will bring up Matt Constantine, our Director of Public Health.
Thank you, Megan. Good morning. This morning we are reporting 194 new cases in Kern County residents, and unfortunately 1 new death. On Tuesday, we did briefly speak about some work that we're doing with County Council on trying to find ways to release some additional data. We have, with County Council's leadership, have re-engaged our HIPAA statistician consultant and trying to find ways in which we can release some additional data, specifically as it relates to those that have passed away from COVID-19. Our hope is that now that unfortunately we have higher numbers, and if we potentially could release some data, maybe not on a daily basis, but on a different interval, we've asked County Council and the statistician if there's some potential. So they're exploring some options. We're hopeful that there's some potential there to share additional information on our dashboard. And then finally, a little bit on plasma donations. We reported this on Tuesday, but it's important to restate this. Houchin has indicated that they have 3 staff members. They're busy all day answering phone calls on plasma donations. Since July 27th, they're reporting that they've had 182 donors, and they have given 674 units of plasma, which is terrific. And most importantly, they reported to us on Tuesday that they do not have any outstanding orders for plasma from our hospitals. So that's terrific. I'm grateful that people are responding. And with that, I'll turn it back over to Megan.
Thank you, Matt. Okay, we're going to go ahead and open up for questions. As always, we'll go in the order that was sent to you earlier today. Remember, it is *6 to unmute. We ask that you ask your initial question, keep it to 1 question. We understand that you'll have follow-ups, but until we've made it through the list, we want to give our reporters the ability to get on to their other assignments. And we will take your questions after each outlet has had the opportunity to ask their first one. We also ask that you keep your questions relevant to the topics that we've covered today. So with that, we will start at the top of the list. I believe we have Tony Lee with KNZR on the line.
Good morning. I hope you...
Good morning.
Actually, I did have a question, although it was not related to exactly what we spoke about this morning. It was more related to the issue of opening the schools. So is that something that you need me to call you later about?
Yeah, there's probably quite a bit of detail that you'll want on that, so we can work with you offline. You can either send myself or Michelle Corson an email, and we'll get connected with you. Is there something related to this today that we can help you with?
No, actually, everything the 2 things that I had were related to slightly different issues connected to COVID, but not specifically to what you've spoken about so far.
Okay, we'll connect with you later after this briefing. Thank you.
Okay, thank you.
Okay, our next outlet is the Bakersfield, California, and I believe we have Sam Morgan on the line.
Yes, hello Megan. My question is about the state watch list, and I see that counties are moving off the watch list. Is there any indication about if Kern County will be able to move off of it soon, and what do we plan on doing if we get the go-ahead or if we get off the watch list?
Thanks, Sam. We'll have Matt respond to your question.
Good morning, Sam. Just to give you an update on the state triggers on the monitoring list in particular, The percent positivity today was reported at greater than 20%. We are asked to be at 8% or below. The case rate is over 300, about 307 right now. They want that to be below 100. The hospitalization change, another category that they look at. The state's database wasn't functioning this morning. We know it's a negative number. They want us to be at 10% or below, so that's good. We have been on this monitoring list for 30 consecutive days. We have watched how the state has added several additional counties onto the monitoring list and then had removed one county recently with an expectation there may be a couple other counties that are coming off the list since they have met the metrics. It's also important to note that as it stands today, even though if the county comes off of the monitoring list, the restrictions the governor placed back in mid-July still stand. So although these counties are coming off, the restrictions to indoor restaurants and indoor hair salons still apply. There has been some recent discussion at the governor's press conference about looking for ways either at a county level or a regional level where counties that are doing well could potentially resume some activities that were restricted. We have no detail. They've indicated to us previously that once you're on the list, you stay on the list, and we would call, as a state, come off of the list. There seems to be some movement there, so we're going to wait some direction. But Sam, does that answer your question?
Yes, thank you very much.
Our next outlet is Kern Radio. I believe we have J.R. Flores on the line.
Yeah, thanks, Megan. No questions for on the topics today. Thank you. Carrie Blind, I love you.
Awesome, thank you. Our next outlet is Channel 23. I believe we have Tori Cooper on the line.
Good morning. Can you hear me?
We can. Go ahead.
All right. So most of the questions have already been answered. If you would just give me one moment here. So what do you guys think about the governor and the watch list? I mean, that's been the main topic of conversation so far this morning. So what is public health's response to where we're at? Is it really just keeping an eye on all of our numbers right now? Where are you guys at with that? What's your response to this?
We'll have Matt respond to her.
Good morning, Tori. So the monitoring list and the metrics are clearly something that we watch very closely. There's also another component about ICU beds and ensuring that we have greater than 20% of our ICU beds available. If you'll notice, we did not meet that one day this week. Today we're back on and meeting that criteria. So we track those closely. Our hope is that we strive towards meeting those metrics with some anticipation that that would then allow us at some future time to reopen businesses, to show the governor and the state that we have made improvements. Clearly we have some work to do, but I think we're moving in the right direction. Tori, does that answer your question?
Yeah, there was only one other thing I was curious about, and I'll leave it at that if that's okay. So we have previously asked Public Health about releasing the background information related to the people who are dying in our community. And as you know, Public Health has mentioned that it would be a violation of HIPAA rights in the eyes of the statistician that you guys hired. That's an outside agency that looks at that. But I guess our question now is, how might this no longer be a violation of HIPAA rights as compared to before when 23ABC first pushed for the release of ethnicity?
Yes, good question, Tori. A couple parameters that we're hoping the statistician will consider to allow us to release this data. One is that unfortunately now we have more than 200 deaths in the county, so that number has increased, and as you know, the more individuals within a pool, the less likely you are to be able to identify that individual and therefore infringe on their medical privacy rights. The other component that we asked the statistician to consider is, although our data is just about released in real time now, as we release data every day, our consideration for them, for the statistician, was what if we release that information on less frequent basis? We looked at Fresno County, who has been releasing some data on those that have passed away. I don't know the frequency. It may be about a month period. We're asking them for their frequency or their interval. So I think those two criteria we're hopeful would allow us to potentially release some more information. So Kim is working with the statistician, and we hope to have some answers soon.
Yeah. I feel like that answers the question for the most part. The only thing that still remains related to that question is, I guess, how is it different than before if we never knew who these people were initially?
So, Tori, could you help me understand that again? How is it different than before? What do you mean?
So how is it different than before if we never knew who these people were initially who have died in our community? Even if we were at 93 deaths related to COVID-19 in Kern County, and now we're sitting at 229 people. Either way, none of us knew who these 229 people were now, and none of us know who the 93 people were then. So if none of us knew who these people were to begin with, how is it different than before, besides that there's a few more people that have passed away?
Understand. Thank you for the clarification, Tori. The statistician looks at the likelihood of you as an individual or as a community being able to identify that person, not if you did or didn't. If we were releasing data real time and there was only one death and you could find some other linked resource, something on social media or an obituary, and that would allow you to connect unrelated sources of data to determine how that one person by their name passed away, the statistician would tell you that that would be a violation of their medical rights or their family's medical rights. So if what we've posed to the statistician is if we broaden the time frame, and now since we have more of the individuals that have died, that lessens the risk. At least that's our view of it. We're hoping that he also agrees and follows along. But that's kind of the approach that we're taking. Hopefully that answers your question, Tori.
Yeah, thank you so much.
Our next outlet is Kern Soul. I believe we have Elizabeth on the line.
Hi, good morning. My only question today, and I'm not sure if you can answer this, but are you able to tell us how many of the deaths are from skilled nursing facilities?
We're looking at the data now, so if you have another question, we can come back to that, and we'll get you the number. But we'll make sure before we leave today that we get you that number.
Okay, great. That was my only question. Thank you.
Okay, we'll make sure we come back to that. Our next outlet is Valley Public Radio. I believe we have Carrie Klein on the line.
Yes, good morning. Can you hear me?
We can. Go ahead.
Okay, great. Yeah, so I was looking to learn more about, so the county just hired on or at least set aside the money to hire on lots of new nurses to bring into hospitals. So I was wondering how many of those have come online so far, and what has the impact been? You know, have hospitals been less impacted because of it?
So, Carrie, there was a little bit of a garbling right there in the middle of your question. I think what you're asking about is ICU nurses, but I honestly couldn't hear. So if you could just restate your question, that would be helpful.
Oh, apologies. Okay, yes. I was asking about how many of the nurses have been, the ICU nurses have been brought online so far from this new contract approved recently, and what has the impact been to hospitals?
Okay. We'll have Matt respond to your question. Thank you.
Good morning. So we have a contract that the board has approved to bring on more than 80 ICU nurses. I think the total is now 88, to be allocated to a number of our acute care hospitals in the county. We have contracted with a staffing company that hires nurses from outside of the area that are willing to spend 13-week intervals with us as they relocate. So they have been interviewing, identifying those that have the skills and the ability to relocate. There have been a few that have come on staff. We had reported out that Kern Medical and I believe one other hospital has received some ICU nurses. I think Kern Medical, as of this week, was bringing on 4 more, and I think by next Monday there were planned to be 10 additional that would arrive. So the system's working. Every hospital works individually with that staffing company to make sure they get the right individual. So they are slowly starting to come. That is going to be a significant additional resource. As we've talked about, ICU beds are really our limiting factor as we look at flattening the curve and trying to reduce the impact on our hospitals. It's not the total hospital beds that present a concern to us. It's actual ICU beds, and in fact, it's staffable ICU beds that are really the limiting factor. So we're hopeful these additional resources would allow us to increase the number of staffable ICU beds so that we remain prepared if needed. Does that answer your question?
It does. And then one follow-up as well. I mean, so what if, I know the numbers have been easing slightly kind of around the valley, numbers of new daily cases and some hospital and ICU rates. So should hospitals actually get fewer COVID patients and the surge kind of relax a little bit in those 13 weeks that we have these contracts? Are those nurses, are they still going to stay working in the ICUs?
Mm-hmm. Well, I'm really hopeful that we will get to that problem. I don't think we will. There is a tremendous amount of work. If in the very unlikely position that we do not have an immediate demand for those nurses, then yes, between the nurse and the staffing company and the hospitals, they can make changes to that agreement. But it is an insurance policy, if nothing else, so I'm hopeful that that would be a problem that we would have. It seems very unlikely, but we would be able to adapt within a short period of time if needed. And then to answer an earlier question, there are 53 deaths that have been associated with skilled nursing facilities. That is reported on the state's website. So hopefully that answers both of those questions.
Yes, thank you.
Our next outlet is Channel 29. I believe we have Tim Johns on the line.
Hi guys, good morning. My question is for Mr. Constantine. You touched on this already a little bit, sir, but I know you were mentioning some of the numbers and that, the metrics that the state has. I was wondering, as one of the other reporters just said, our cases and our hospitalizations seem to start to be plateauing and starting to decline a little bit. Are we cautiously optimistic that this is a trend we're going to continue to see over the coming weeks? I know the LA Times just posted an article a day or two ago that kind of blasted us. And I was just wondering if you guys are kind of cautiously optimistic about where we're going.
Thanks, Tim. We'll have Matt respond.
Good morning, Tim. Unfortunately, no, I'm not optimistic. Most hospitals in the metropolitan Bakersfield area are at or exceed their ICU capacity. We have beds available, but those ICU beds are really in short supply. We have been fortunate over the last few days to see smaller new cases per day. We're really hopeful that those numbers stay low. We have seen a concurrent decrease in demand for testing, as Megan mentioned earlier. So it does seem to kind of coincide with the levels of testing. We're hopeful that some of the interventions work, but the model still shows that cases will continue to rise through February of next year and then slowly subside going into the summer of next year. We're hopeful that model can be changed, and perhaps we can influence it more, but it's really too early to draw any sort of conclusion to this point. And we continue to prepare for what the model has been predicting so that we're ready to assist, but a little too early to tell, I think, at this point.
Okay, thank you.
Next, we have Channel 17. I believe we have Eitan Wallace on the line.
Good morning, Matt and Megan. Matt, on that note, on the ICU beds, you mentioned earlier this week we were around 20% at the capacity threshold that the state would like to see. Where do we stand today, and how many ICU beds are available in our hospitals?
So, Eitan, we're pulling up some data to get you numbers, and I think Matt will respond to the first half of that question. Thank you.
Thank you.
Eitan, I'm sorry, Kim and I were trying to discuss the question to get you an answer on the ICU beds. Could you repeat the first part of the question?
Thank you. Yes, just about the 20%. You mentioned earlier that the state we're bouncing in and out of that capacity of the 20% surge capacity for ICU beds. At this point, you're saying though that we are below the threshold. Yes. How do we stand today?
So we have been hovering above 20%. The state has made some definition changes on what is counted in the ICU beds. They've changed from including NICUs into ICUs and not, so they've gone back and forth. Kim is indicating, I believe, that we're at 17.7%. Is that correct, Kim? On our ICU capacity. We have been talking to the state a little bit to try to understand why the numbers have changed. But it does show that, again, ICU beds is a metric that we need to track very carefully, as we believe that may be the limiting factor in Kern County.
And thank you, Matt. And just following up with that just for a moment. So when you say 17.7%, that means we're 17.7% above the capacity, the normal capacity limit?
No. So, Eitan, they're asking us to have 20% or more of our ICU beds available for use. And I think what Kim is indicating is that we have just about 17.7% of our ICU beds available today.
Thank you.
Okay, before we open it up, I want to go back to Tony Lee with, I believe it was KNZR, and just ask if you wanted to ask. I think you had some questions, and I wasn't sure if after hearing these you feel like they're relating to the topic or not, but I wanted to give you that opportunity if you wanted to circle back.
Yes, thank you. This is Tony at KNCR. What I was curious about was whether or not the nurses, as I have understood it in the past, that was the thing that we were missing at the ICUs, that there may have been some beds available, but we didn't have the staff. And then I later understood that there were National Guard medical personnel who were available to come in and assist as staff members where they needed. Would that be something that we have used here or that we could use?
Yes, we have used that, and we could. Let me give it to Matt and see if there's anything he wants to add to that.
No. Good morning. So yes, as we've reported before, the state has a couple different types of medical teams that can be allocated to Kern County based on need, and we have had multiple teams at several of our metropolitan Bakersfield hospitals where they have come in for 72-hour durations to provide some immediate relief when staffing was limited and the number of patients was high. So that they have come down for short periods of time, and that remains a resource if the hospitals need it. Does that answer your question, Tony?
Yes, sir, it does. And one other thing that I wondered also, when we are now trying to reopen the schools, there's a big push going on to do that. And I've seen across the nation where many other schools that opened already a few weeks ago have had to shut down again because suddenly they had a spike in those cases. And while I know you are not the enforcement end of this whole thing, I'm wondering if there has been given any thought to how to keep that from happening here. I've heard a lot of talk about people opening the schools and students going back into the classroom. I have not heard very much about what's going to be done to safeguard those students when they're in the classroom, other than just a little bit of distancing and some hand washing stations.
So, Tony, timely question. As you know, the state's order indicated that based on our metrics that we have locally, schools had to do a distance learning only. They could not allow for in-person teaching. They did allow for a waiver process for elementary schools to submit to the local health departments, who then has to submit it to the state for review and consideration for a different process. So that waiver process that the state has established is pretty thorough. They do ask us to look at our case rates, but also look at all of the interventions that the school is proposing to institute, from requiring children to be spaced apart in classrooms, to requiring face coverings and cleaning, and how you drop off children in the morning and pick them up, and how you pick up papers and staplers. And so, as we've spoken about before, we are receiving some of those waivers requests, and there is a pretty thorough set of policies that is being proposed. In addition, they are required.
I love shoes. You find them in the store, you know, they like call you, but they hurt. The best ones.
To achieve that all prior to coming forward and asking permission. So it's a pretty elaborate process that the state is asking the waiver process to go through. And the ones that we've seen, the two that we've reviewed, have been very robust. They've been very small schools. They have the ability to provide distancing and hand washing that you mentioned. I believe that those proposals are safe. We've sent them on to the state for their review and opinion. So if done right, I think it can be safe.
All right. Thank you, sir.
We'll open it up for any other follow-up questions.
Yeah, I had a follow-up question. It just came in from my newsroom, if that's okay. So they wanted to know if the number of deaths reported on Tuesday and Wednesday that totaled 24 are in real time. Matt had mentioned that you guys were now reporting data in real time.
Hang on one second.
Did you get Kim ready?
I think Kim is getting us an answer. Hold on. So the deaths are not necessarily in real time. They depend on the determination from the medical provider. And that can take several days. Sorry, Kim's given me some information. So those are not necessarily in real time.
Okay. And the last part was they were wondering about the masks. Considering that the air quality has been a problem the past few days with the smoke from the fires, the public health believes that the mask wearing is going to help protect from some of those issues that we're experiencing air quality-wise.
So just make sure I understand. You're asking if the masks that we're suggesting people wear for protection related to COVID-19 are also a protection against the particulate matter, the ash that's in the air resulting from the wildfires?
Yep.
So they may provide, again, I'm getting information from Kim on this one, so they may provide some protection or assistance from the large particulate matter, although they're probably not, they're not intended for that purpose.
Okay, thank you.
Are any other follow-up questions?
Hey guys, Tim here. I have one quick follow-up question. I know the Olive Knoll School has gotten some press over the past couple days They say they've been in touch with you guys about getting, they've been operating the formal education waiver. I just want to confirm that that is true, that you guys have been in touch with them over the past couple weeks and months, and that they're operating, completely in compliance.
So I'll have Matt respond to that one, Tim.
Thank you.
Good morning, Tim. I'm vaguely aware of some of the attention. Yes, we have one person assigned to do just this, to review those applications and respond to any questions or concerns. I firsthand don't know of any specific information about that facility. I'm happy to talk to my staff member to find out more for you offline, but as I stand here today, I can't tell you a current status.
Okay, so we can email either to Michelle or Megan and get some further clarification on that. Thank you.
Absolutely.
Any other follow-up questions? Okay, we want to thank our interpreters for being here today. We appreciate their help and assistance as we make our way through this, and we will see you next week. Thank you.
All right, you have just been listening to our county officials give an update on the coronavirus crisis here in Kern. We've unfortunately learned of one new death here in Kern County over the last 24 hours. That is a report. That does not necessarily mean that someone has died within the last 24 hours. That is just a new death that was announced. We also learned that 194 additional people have tested positive for coronavirus. That brings our total to 27,378. Our county officials say that all testing sites in Kern County are reporting lower wait times. They also stress that the federal testing site at the Kern County Fairgrounds will run until Friday, tomorrow, which means if you would like to take advantage of that federal testing site, which is turning test results around within 3 to 5 days, it is free. You can make an appointment at kerncounty.com and then show up either today or tomorrow to get that test and get those results within 3 to 5 days. The other thing that they mentioned is that, as you know, we just talked about hospitals but at the beginning of this news conference. They are inundated with patients regarding that have coronavirus, but they say that they are receiving a lot of praise from doctors when it comes to the success of plasma donations. They say that about 600 units of plasma have been given to patients, and that has proved to be very successful in the recovery of those patients. So that is definitely good news, and they stress that Houghton Community Blood Bank is still taking appointments for people who want to donate their plasma if they have recovered from coronavirus. That means that about 10,000 people, at least 10,000 people in coronavirus, or in Kern County who have recovered from coronavirus can donate. And again, doctors are saying that that is proving to be successful. We have more news on our website, kget.com, on the coronavirus. Just search for that tab, and we'll also have more coming up today on 17 News at noon. Until then, I'm Alex Fisher in the 17 studios. We'll see you back at noon.